5 years. Now, Gloria Milimu now joins us live. Gloria, why is there a surge in deaths, and specifically for those children below 5 years old?
This report by UNICEF, dubbed Levels and Trends in Child Mortality, estimates that more than 100,000 children under the age of 5 years are dying due to preventable causes. When you come back to Kenya, okay, this report actually looked at these trends in more than 50 countries. And here in Kenya, we know that pneumonia remains one of the main killer diseases among children under the age of 5 years. When you look at, in terms of just preventing this disease, Ashley, there is a vaccine that's normally offered to children below the age of 2 years. And when this is not done, actually this is something that is preventable, and it's through that vaccine. When it's not done, these children are exposed. Remember, pneumonia is an acute respiratory disease that can be prevented through the use of immunization and also nutrition. When it comes to issues to do with the mortality rate, we're still lagging behind as a country in that we are recording 32 deaths per 1,000 live births among children. And when you look at in the under 5 mortality rates, we are at 42 deaths per 1,000 live births. But when you look at this report, Ashley, it actually advises countries to ensure that they record, when it comes to these mortality rates, they record at least 12 or low, they record at least 12 or below this number of deaths per 1,000 live births. And when it comes to children under the age of 5 years, this mortality rates should be at 25 or below that per 1,000 live births. And other issues actually that are contributing to this number of deaths among these children, MOH actually acknowledges that quality of service remains a major concern when it comes to treating children who have complications at birth. And also, there are issues to do with patients and patient-doctor ratio. In this case, the ratio of babies to the nurses also is a major concern, where you'll find that a nurse attends to about 15 babies. So maybe if I can just give you some data from the Kenya Health Information System, it indicates that only 25% of sick newborn babies are cared for in a facility that is able to at least provide basic minimum health services. So when you look at this actually, and health is a devolved function, we know of counties that report an increase in this number of mortality rates. This is a devolved function. What are these counties doing in terms of preventing these deaths and attaining the goal number 8 of the Sustainable Development Goals that aims at ensuring that children thrive? Children below the age of 5, they thrive. So these are some of the issues that we'll be interrogating, and the stories putting the counties to task to just tell us, in terms of their budgetary allocations, what are their allocations in terms of preventing these deaths, ensuring that these children thrive, and also what measures have they put in place, apart from the budgetary allocations, what other measures have they put in place just to ensure that as a country we attain this Sustainable Development Goal number 8. Ashley.
All right. Thank you very much, Gloria Milimu, for that. It will be interesting to find out what exactly they're doing to ensure that this trend